We are very pleased to be handing over these 5 boats to the various regions. As you heard, we'll be giving 3 of these boats to Regions 1, 1 to Region 3, and 1 to Region 5. Over the last 2 to 3 years, the ministry has made a deliberate effort in trying to secure a number of boats and vehicles to assist with transportation, both of our healthcare workers and, of course, patients. So, over the last 3 years, we would have given out to the various regions a number of ATVs. We have given a number of ambulances, and we have also given out boats. And this has made the network that we have in the region more accessible. With these boats, you've heard different uses of the boats. The primary use would be to move patients in emergency setting, but we will also be using these boats to do outreaches. Because of the remoteness where they'll be operating, villages are often very far apart, and what we want to do is to put medical teams on these boats so that they can go to various communities and deliver care. So the fleet that we have here would be adding to what exists in the region. Apart from improving transportation, in Regions 1, at this present time, we have done a lot of infrastructural works. We have expended this year close to $200 million in improving a number of health centers in Regions 1. And we have added some new facilities too in Regions 1. We are also in the process of completing a survey and clearing a site in Moruca. And very soon, we are hoping to start the construction of a new Moruca hospital. So this would complement the level of care that we'll be able to give in Region 1. And this comes as we have also, over the last 2 years or so, improved the facilities at Mabaruma through the Smart Hospital project, and we have improved the facilities at Port Kaituma. So when you look at the kinds of development, it's not just about the infrastructure, but also about making sure that we have good transport for our patients and our workers. In addition to that, we have also invested a lot of money in training. And now at every health post or health center that we have in the region, we would have a community health worker, at least 2 of them, assigned to each of these facilities. And we have also introduced telemedicine in some of the centers, and we'll be expanding the telemedicine in some of the most remote areas so that we can improve the quality of health care that we are delivering. In terms of Region 3, as you heard from the RHO, this is something that we really want to have in the river because from time to time we do have challenges when patients have to move from Wakenham or Legwan to come across. Sometimes they have difficulty. So this boat that we'll be giving to Region 3 would help to complement those services that we are putting in place in the river, in the Escribo River. Regions 5, on the Maikoni River, there has been some challenges, and we have some very remote communities, especially those beyond Mora Point. You have for Savannah and some of those other communities, but stretching all the way into Maracaibo. And again, this boat is going to help to deliver services and to make sure that those persons who have emergency needs would be able to get transportation to get to the hospital at Maikoni. So I think the effort here this morning, I want to thank the staff for making sure that we are able to get these boats in a timely manner. And we want to urge the persons in the region to take good care of the boats that we are giving. We also don't want these things to be locked up. and people, when they need it, can't have access to it. Because sometimes we have assets, and the person who is supposed to be, you know, captaining the boat or moving things around, sometimes they, for whatever reason, they're not there on time. If we are going to provide these services, it's teamwork. And while the ministry has made an effort to get the equipment in the region, we also have to have the people there to be trained, because we're paying them to be on the job and wait for these emergencies. So they have to be there, and whenever an emergency arises, to make sure that they're able to deliver patients in a timely manner. So I hope that we'll be able to put all the right systems in place and to monitor to make sure that these systems are functioning. So once again, I want to thank the staff. And for those of you who are wondering, the 5 boats have cost $23 million. And as I said, this is just a small complement to what we have already given.
Region 3 is more than elated to receive this water ambulance. It has been something that we have been striving to have in the region for a while now. As you know, Region 3 covers the Essequibo River as well, up to Makara, which includes 2 large islands, that's Wakenham and Legwan, and of course all the way down covering quite a few other islands, which is in totality a population of just over 9,000 persons. So this boat will be able to ensure that these persons can access health care on the coastline at a faster rate, because it is expensive to hire a boat in the middle of the night in order to get your relative out, and that is a burden that we are trying to take off of the persons in those areas that are often in more of a needy situation. So this will come in very handy to ensure that those persons receive at least equitable health care as it relates to transportation especially. Thank you.
Good morning, I'm Dr. Sarju, RHO5. This boat here will be used in the Moroccobai River, which will benefit over 1,200 residents from that area. Also in the Moroccobai River, we also have Mora Point Health Center. Not only will this boat be given to Moroccobai, it will also assist the resident there from Mora Point. We find that most of our patients may not have access to the health care there in those areas because of the distance and the transportation that they would need. So this will greatly benefit the residents in Region 5.
Hi, good morning. On behalf of Dr. Shifun, the Regional Health Officer of Region 1, we would like to thank the Ministry of Health for providing these boats to our region. We are currently in Region 1, where there's a lot of riverine areas, and a lot of the citizens there, they have to take a long time before they can access healthcare. Now with these boats that are provided, we're going to make that easier for them to access healthcare, and we're much appreciative of the ministry's effort in making healthcare more equitable.
At RHS, Regional Health Services, we're here to give support to the regions. And this morning, handing over of these boats is one of our efforts of how we are supporting the regions. We're supporting Region 1, where they'll be getting 3 boats, Region 3, 1, and Region 5, 1. These boats not only will be helping in emergency efforts, but also to increase our vaccination coverages in these regions, which is very important. So, as I mentioned earlier, we here at RHS, Regional Health Services, we're here to support the regions in whatever way we can. And that is what we're going to continue to do. Thank you.